What is exchange transfusion for sickle cell acute chest syndrome? Imagine a situation where someone with sickle cell disease suddenly develops serious lung problems that threaten their life. This is what doctors call acute chest syndrome, a dangerous complication that needs quick action. One of the most effective treatments for severe cases is exchange transfusion. This procedure involves carefully removing the sickled red blood cells that are blocking blood flow and replacing them with healthy donor red blood cells. The goal is to lower the amount of sickle hemoglobin in the blood to less than 30% and raise the overall hemoglobin level to about 10 grams per deciliter. This helps reduce the sickling of cells, lessen blood thickening, and improve oxygen flow to the tissues. Unlike simple transfusions, which just add healthy red blood cells, exchange transfusions physically remove the abnormal sickled cells at the same time as they add new, normal cells. This prevents the blood from becoming too thick, which can happen if too many donor cells are added without removing the sickled ones. Doctors usually recommend exchange transfusion when a patient has very low oxygen levels, rapidly worsening lung symptoms, or if they do not respond well to simple transfusions. It is also used in high-risk situations like pregnancy or when multiple health issues are involved. Acute chest syndrome in sickle cell disease presents with symptoms like fever, chest pain, difficulty breathing, and new lung infiltrates visible on chest X-rays. Early treatment is vital and includes antibiotics, pain relief, oxygen therapy, and blood transfusions. When the disease is severe or progressing quickly, exchange transfusion is often advised by medical guidelines from the United States and the United Kingdom. It can rapidly improve oxygen levels, decrease the number of sickled cells, and prevent further blockages in small blood vessels. This makes it more effective than simple transfusions in critical cases and helps avoid complications from thickened blood. Of course, like all medical procedures, exchange transfusion has risks. These include reactions to transfused blood, iron overload from repeated procedures, and the possibility of developing antibodies against donor blood. It requires specialized equipment and skilled healthcare providers, usually performed in a hospital setting with careful monitoring. In summary, exchange transfusion is a vital treatment for severe acute chest syndrome in sickle cell disease. It works by quickly reducing the number of sickled cells, improving oxygen delivery, and preventing serious complications. It is generally used when simple transfusions are not enough or when the illness is rapidly worsening. Always consult healthcare professionals for personalized advice and treatment options, as each patient's situation is unique.